everybody. Thank you for joining us here on What's Happening in Health. Got a great show today of hope and healing. Today, just in time for Valentine's Day, Dr. Jon Mendelsohn, he's getting ready with the gloves. He's going to show us how to have more kissable lips. Ooh, we love that. Our model Hope, she's had some work done. We're going to meet them and hear more in just a moment. But first, just ahead, as we said, more kissable lips, just in time for Valentine's Day. Can't wait to share what's hot and what's not. Dr. Jon Mendelsohn and Hope are in the house. He's going to show us what he calls the perfect point. Stay with us. Welcome back, everybody, to Look Good, Feel Better. We have a great lead up for Valentine's Day with Dr. Jon Mendelsohn in the house. Good morning to you.
Thank you.
Hope is our model here. Now, they're one unit. We have to take off masks because we're treating her lips coming up for Valentine's Day. And I'm keeping my distance here. But we've been talking to you kind of this whole pandemic a little bit about something pretty remarkable. There's been sort of a surge in plastic surgery demand, which is kind of surprising. But here's a little bit more about that.
Since people are looking at themselves on Zoom all day long, they're quite picky and frustrated with some of the changes that they're seeing in aging.
Blame it on those screen time close-ups, says we're socially distant these days. And what's above the mask?
We've actually seen more in the non-surgical area with Botox and fillers, and we've seen more with surgery as well, particularly eyelid surgery, blepharoplasty, yes.
That lid lift takes about 20 minutes as an outpatient procedure. As these results provided by the Advanced Cosmetic Surgery and Laser Center show, the results, however, pretty dramatic. As for eyes non-surgical,
1, 2, 3, quick little poke.
Newer fillers are in hot demand right now.
We're getting tear troughs. I have a hard time saying that. Done today. I do my makeup every single day because I'm a makeup artist, so I can always see my dark circles. So the Revance line of fillers, they're hyaluronic acid gel fillers, just like we're typically used to using. However, the molecule is a longer chain, and so they can be a little bit more flexible.
Wallace Doyle's results happen right away. Finally, facials that suck up the surface of the skin are a big demand to get rid of maskne right now. So you're looking a little red. What does it feel like?
If I were to compare it to anything, it almost would feel like a cat tongue, like if a cat's licking you. I mean, it's not painful, it doesn't hurt, it's really not bad.
And fuller lips seem to soften what's seen on screen.
I would just like a little extra volume in the upper lip. I tend to emphasize that when I do my cosmetics anyway.
We're using Restylane Kiss on Amber. It is a new hyaluronic acid filler with expression technology, meaning that it's a soft, movable filler.
The goal? The natural look. In a pandemic time, that is anything but natural. So the reason we wanted to follow up that is you said the demand has not stopped.
It has not.
And I said to you, well, you know, why are lips popular for Valentine's Day?
Lips have been popular through the entire pandemic. It has been, I think it's because of Zoom, and I think it's even with the younger population, with students in classes, they all see themselves a lot.
Because I thought with the masks, like that'd be the last thing you would see.
I thought so too, but it is increased if not anything.
All right, well, you know, we call it sometimes a lipstick effect. When we can't do anything else, we do something to make ourselves feel better. And this is like kind of the less expensive stuff compared to plastic surgery. So one of the things I wanted to ask you, we have some video of her before and after lips that you did that I just want to put those up because you can really see a difference. But you said something you didn't work on here is what you call the perfect point. So what are we talking about?
Yeah, well, a few things. So what we talk about is an area called Cupid's bow, and Cupid's bow, Cupid is the Roman goddess of erotic love, just so you know. And it's this area in here, the points of her lips. Now, Hope, we're going to refill some of the pink part of her lip down here today, okay, and work on some of that Cupid's bow. Okay, so you go to work on that and just tell me what you're doing. I asked you first, like, this is one of the fillers that we just heard about sort of in that piece we just saw. And you put a little bit of number on her so you needle shy people don't need to freak out, We actually didn't put anything on her.
Oh, you didn't put any number on you.
Nope.
Are you all right with that, Hope?
And she doesn't need it.
I know she can't talk.
So what we do is we make a little tiny incision, or no, a little stick, and let's see if we can find our needle hole here. And what we do then is use this cannula to place the product. I'm trying to do two things at once here. Hope you okay?
Mm-hmm. She's a trooper.
It's a tiny little needle. There we go. So what happens here, Liz, is we're going to advance this and place some of the product as we move forward. She'll feel it. There's lidocaine in the product as well. So as we advance with no other local, she'll tolerate it quite well. And we're to this midsection right here, and we're going to place some of the product. And the nice thing about this cannula is we can get all the way to the left side of the lip with it as well through one incision, one injection.
So a cannula is something that just allows you to sort of have a flexible point, or?
Right, it's a blunt. It's not a needle. It looks like a needle if your viewers are watching, but we use the needle to make a little entry area, and then we basically just place some of this product.
She's a very still patient, I must say.
She
so
is.
in the end, what you're hoping to do is you have that little kind of upper lip, and her lips looked pretty perfect, even though you'd done kind of some initial fillers and things like that. But this is sort of the final.
Yeah, sometimes we do a touch-up. She had this done last week, and sometimes there's little adjustments that are made. So this is a really easy procedure. You can come into the office. It takes a few minutes as you're observing. There's usually a little bit of swelling. Patients do real well. These high hyaluronic acids are very soft products. They're very natural products. They're reversible, and they're easy to manipulate or massage as well. So they're easy to contour. So I'm gonna bring this out a little bit here.
Hope, you are a perfectly still patient, and we appreciate that. I know you can't respond or anything, but clearly then she's not feeling too much pain, or she'd be jumping around, I would guess.
She's not. So we've put about only less than a half a cc in. What I'm going to do now, you can actually feel the product a little bit. It's very soft, and we can just contour it and massage it a little bit just to make sure it's all even and symmetric. Now I'll come back, and I don't know if we'll do this right now, but I'm going to come back to Cupid's bow a little bit. But just with that change, you can already start to see there's more volume in the red part of the lip.
And that's sort of the goal. Okay,
that was her goal, because she felt like with the first injection, it was a little bit full along the vermilion border, which is the area between the white and the red lip, and she needed more volume here, so it balanced with her lower lip a little bit more.
So that's how you don't get like, I hate to say it, but like duck lips.
A ducky look. It's exactly right.
We all know like what those look like. You look beautiful. She can already smile and everything. And what that does is sort of gives the little, I don't know what you call it, there's like a divot,
It's called the philtrum, actually.
Okay.
Yep, and the philtrum comes right down to the Cupid's bow, so it's a good area.
Like right in here.
That's correct.
So these can range in cost starting as low as
$350 to $950 probably.
And it just depends on how much product you use.
Depends on the type of product and the volume of product. Yep.
All right, how you feeling?
I feel great.
All right, it looks really good too. And this will last roughly how long?
Probably, with lips, things don't last quite as long. Probably 8 to 12 months.
And that's because we're always using them?
We're using them. It's more mobile and more vascular. Yes. And other parts of the face that last 2+ years.
Yeah. Well, you look beautiful. I appreciate the subtlety. You wouldn't want that, real pronounced lip. We do want to let you know how to find this team. I know you guys have been amazing at just educating us on, little things that are kind of fun. If someone you love is looking for a great Valentine's gift, 513-351-3223. Be a little careful how you say to them, like, hey.
So Liz, can we get you in the chair?
See, he knows, like, this is super sensitive stuff. I'm not asking for the gift right now. Hey, Jon, thanks for being here today. I so appreciate your team. Hope
Thank you, Liz. We appreciate it. Thank you. Happy Valentine's Day.
Happy Valentine's Day to you too. Hard to believe it's a week away.